You are listening to Radio Maria Canada. We now present the Health Hub, hosted by Kathy Biasi.
Welcome to the Health Hub on Radio Maria Canada, exploring cutting-edge health and wellness information and therapies, helping you to take your health to the next level. I'm your host, Kathy Biasi, and I'm a holistic nutritionist and a professional cancer coach. Bringing stories and people to you that are really moving healthcare forward is an underpinning of our show, The Health Hub. And today we are talking with Dr. Parker Hayes, an emergency doctor with over 30 years experience in the ED. Dr. Hayes, as well as being a seasoned board-certified emergency physician, medical director, and professor, is the co-founder of Lasting Impact Wellness Group. With a background in emergency medicine, he specializes in men's health, emphasizing physical and mental well-being for men over 50. Beyond his medical career, Dr. Hayes is an accomplished speaker, podcaster, and author, addressing topics such as male sexuality, fitness, and health. With over 20 years in academic leadership roles, he has trained and mentored medical residents, earning accolades for outstanding teaching. As a strong advocate for men's mental health, Dr. Hayes fosters dialogue and solutions for executives, emphasizing sustainability and longevity in wellness practices. His dedication to personal growth, transformation, and medical expertise makes him a powerful voice in this field. On our show today, we are talking with Dr. Hayes about how his years in emergency medicine has impacted his view on mapping out longevity. We talk about emerging science that is and will impact longevity and the overall healthcare space. And we get Dr. Hayes's view of improving health span, living a healthy, long life. Stay tuned with us. We will be back in just a few minutes to talk with Dr. Hayes.
You are listening to Radio Maria Canada. We now continue with the program, The Health Hub, hosted by Kathy Biasi.
Welcome back, everybody. Today's show has been recorded, so no opportunity for calling in. Please do follow us on our social sites. We are on Instagram, Twitter, and Facebook, and we are at the Health Hub RMC on all locations. Dr. Hayes, welcome to the show. Thank you so much for joining us today.
Thank you, Kathy. Honored to be here.
I always love to have medical doctors on our show. We've created the Health Hub so that we can, hub is the operative word there, so we can see all different aspects of health and all contributions of health, because from the avenues I've gone down, there are so many different ways that we cultivate health. But from the beginning of the Health Hub till now, I have been seeing more and more medical doctors take on some integrative therapies, some more than others, but I see a promising road ahead. What have you learned from your years as emergency doctor about health, longevity, and the need for different ways to cultivate longevity?
Well, thank you. Terrific question. I think the emergency department is a great equalizer. Mm-hmm. The old adage about nothing is certain but death and taxes should include a third thing, which is going to the emergency department. everything arrives there, or somebody may go there with a friend, but most everyone is familiar with that branch of medicine in general. So the end results of people's choices, decisions, circumstances, shortcomings, victories, they are on display for 12 hours a day for me in the emergency department. The one thing about most of those, however, is that they are downstream expressions of those circumstances. And I've had the fortune of connection to the entire socio-demographic of society for these 30-some years. But I've also seen a lot of choices gone wrong and things that could have been prevented with an upstream intervention presented in their rawest and sometimes most violent or sometimes most final forms in the emergency department. Over the years, even as a fix-it guy, I like to go in and fix the immediacy of an emergency presentation. But I found myself asking more and more, how did you get here? Why did you get shot today? Why did you take an overdose? Why are you having a heart attack? Why are you having a stroke? This, of course, is in parallel with my own aging and managing of my own family. And I began to ask those questions professionally as well and search for more answers to how we could prevent people from having some of the outcomes that I saw in such glaring fashion day by day. I had a bit of an epiphany once with about 2 or 3 years ago, sitting in a cafe and an ambulance went blaring by. My wife and I had already begun this journey of preventative medicine and leadership coaching and well-being. But I thought, wow, that ambulance, I've spent years and years knowing exactly how to take care of anything that comes off of it. But now I need to spend a lot more time preventing people from ever having to get on it in the first place.
Would you say, you use the word preventative medicine, would you say preventative medicine is an integrative approach, or are you keeping the two avenues separate?
I think they are Venn diagrams that have overlap, but they are not necessarily the same thing. Holistic or whole health medicine or any number of other terms may be more applicable to given situations, but they all should be inclusive and open-minded to the tenets and successful aspects of other labeled approaches to medicine.
So you feel that most of your or all of your approaches are based in science. You're not using sort of the integrative approaches that are a little bit out there.
Oh, I guess I am, absolutely. On the other hand, science is about observation. And any practitioner who's been doing it for a long time uses a significant amount of gestalt, of clinical impression, of their own experience. By definition, are those things subject always to extensive randomized clinical trials and exhaustive medicine science? No, they're not. That's kind of why you see a real live human to talk with about your problems. You want some of that person's regular experience and human interaction, which may incorporate, I don't know, out there things at times if they think that they will be efficacious.
So you started Lasting Impact. What is the goal of your clinic?
So it's not a clinic, it's a coaching and consulting service for individuals and organizations to help them achieve better health and well-being overall. It's designed to go beyond traditional wellness programs that may be offered at the organizational or for your individual level, and help people achieve a greater holistic version of well-being for themselves. It may incorporate much more mind-body connection, core values, a real examination of their functional fitness, their nutrition, prevention of burnout, improvement of sleep, improvement of recovery and resilience. But most of all, how do you place that all together after achieving self-awareness where your shortcomings and areas of excellence may be, to bring it all into balance?
Now, have you yourself, I can imagine the answer to this question, but have you experienced burnout? Is this one of the areas that is a special area of interest for you?
It is. Emergency medicine is legendary for its burnout rates. And I guess burnout is not a pass-fail test. Burnout rates, I burned out, you're done. It's not like that. It's insidious at times. It's gradual, and it may be episodic as well. Oh, I'm really burned out. I'm down, and it causes one to manage a condition like burnout at different times in your career. I undoubtedly have felt those things, sometimes at surprising times. One would obviously point to the pandemic and the challenges of recent years, but I started my career during a different epidemic, HIV, and then I practiced through other epidemics, some of which are also ongoing, crack or cocaine in the 90s, the opioid epidemic. I guess somewhat bitterly, I laugh and say I've survived through all the demics, 3 epidemics, a pandemic, and academics.
Where would you say that, we can talk about having better health and then call it longevity, right? And longevity, what does longevity mean to you? A lot of people, it is a word, you can define it, but when I'm talking to different practitioners, longevity can mean something different to people who are trying to preach it, encourage it, and teach others. So for you, what would you say longevity is?
Well, longevity by itself is just the numeric attainment of longer ages. And frankly, I'm not really that interested in that. I don't need an extra 10 years severely altered in a nursing home. I could use another couple of years or longer as a healthy, vibrant, interactive person, providing some good to the world and helping to nurture my family. So health span, of course, is the next term that has been spawned over the last 15, 20 years of what's the amount of time one can remain free of disease. I like to go beyond that to optimal health span, which is what's the amount of time one can achieve a greater holistic well-being and be that interactive person with one's loved ones, but also one's community, nation, and the world.
You have a unique opportunity because you are in the medical space of seeing emerging science. So when it comes to health span and longevity and our overall health, are you seeing some emerging science that you're excited about come into your medical space?
Oh, I think this is a really exciting time, Kathy. I think that some of the greatest breakthroughs we've had in attaining greater health span are occurring right now. And I think many of the biggest breakthroughs may be right around the corner. To some degree, however, a lot of what we already know, we're just bringing into better focus. Things like movement and exercise and its impact on our longevity. And when to answer your previous question, if I talk about longevity now, I mean health span. I mean the furtherance of one's optimal health span, not just numeric ages. But, we've known that exercise might be good for you for a long time. There's a gym on the Titanic. But exactly what that means through good science and being able to follow people longitudinally, blue zone study, all kinds of other things are showing non-sexy things like your nutrition and your social connections and your movement to be some of the most potent drugs we have, if you will. But beyond that, too, then there's emerging science, cellular messengers, medications, supplements, things that might change the biology of cells or alter your epigenetics or even genetics that are really dramatic changes on the horizon.
How do you keep up with all this? You know, the advancement of computers and technology and AI, how are you able to keep up?
Well, nobody does. That's pretty much why we're inventing AI. I think it might boil down to machines are not going to necessarily be better than humans or vice versa, but humans with machines and the ability to amass and assimilate burgeoning information, human and machine are going to win. But you're always going to have one or the other. How do I keep up? Honestly, to some degree, you keep it finite, the areas that you're interested in, but it has to be done through a comprehensive lens. I'm interested in overall health and well-being, but as new studies emerge and I read them, then I hang them into certain categories, perhaps of those pillars mentioned: self-awareness, functional fitness, nutrition, sleep, emotional health and relationships, financial awareness. So you file things away. You bring home your groceries and you know where to put them.
I do, as an emergency doctor, while you are on your shift, are you imparting some of your knowledge on your patients, or is this completely, you've got your hospital setting, you've got what's in front of you, and you've got lasting impact?
Oh, no, I would not say it's nearly that siloed or compartmentalized. There are time constraints to both. I don't have time to go through exhaustive examinations of people's risk factors and their well-being in the emergency department. But you virtually always have time to make some human connection, to make that person feel understood, listened to for even a short time, even as you're attending to a high acuity situation. And that really opens a window for at least one aspect of education to take place. Now, first of all, that education doesn't occur in one direction. I learn from my emergency patients all the time. And the weirder their problem, the more I learn from them because they are the expert. But yes, there are moments where I hope anyway that I explain things to patients. This is what your gallbladder is. This is what atrial fibrillation is. And have a mini lecture. Doesn't take long, but it's well rehearsed and hopefully succinct. And it's very humbling for patients to say, no one's ever explained that to me before. Now I finally understand what you're talking about. It's a frightening, chaotic, frenetic place, the emergency department, but patients navigate it so much better if they just have a clue what's about to transpire and why. And those innately are great educational opportunities.
Well, we always hear about the constraints of time with doctors, and that's something that is always, faulted upon the doctors, is that they don't have time to explain and they don't have time to do this and that. So I imagine that the questions, the impact of your questions when it comes to working with people are important. Do you have an approach, a unique approach that you would say is a unique approach when you're working with your patients?
I can't say it's unique, but I think I feel very strongly about when I first interact with a patient. First of all, I try to make that human connection. I'm sorry that you have to be here, or I'm sorry you're going through whatever you're going through, after I've established their name and who I am, et cetera, and who's who in the room. And then I always thank the people who are with them for being there. They don't want to be there, but they are supporting a loved one. And acknowledging that human support of each other is where I start. But the main thing I stress is, tell me what's going on, and then be quiet. Shut up. Don't interrupt the patient if you can. Let them begin to tell their story in their own words. Now, that can't last forever. It depends on the condition. If the patient is psychotic and has rambling thoughts that would go on for days, you can't follow the same formula every single time. But letting them go and tell their story will often be a much richer version of collecting the history than interrupting with staccato questions just so I can check boxes in a chart. We teach medical students to listen at times to certain time constraints, 60 seconds, 90 seconds. Don't interrupt the patient. The guideline I use is at least listen past the first major pause. So the patient may begin to talk, and they're here for headache, and they say, well, I've got this headache. It's terrible. It's throbbing. I had to leave work. My friend brought me here. She had to leave work, and she's a Sagittarius, and she owns a pet shop. And I just want to make sure I wasn't having a stroke. Well, that patient's concern didn't come out in their first couple of sentences. They had to process this crazy situation that they're in. But being quiet, letting the patient exhaust their version of events first before prompting questions, I think would be the first central tenet to my methods.
You have to know you're unique. You must be impacting other doctors with this approach. We had a recent experience with my husband in the emergency department, and it wasn't the best experience. One thing that I found out with all the doctors that we talked to is they're really not interested in questions from us. He had to have an operation on his knee, and I simply asked a question, which, I've read that there are 2 different ways of doing this. Stop breathing, I was told. And, someone in me who has a little bit of a background, I was really taken aback. But I felt, this man's going to operate on my husband. I can't push. I can't say anything like that. I don't feel that there are a lot of doctors who, at least that I have experienced. I can't put everybody in a box. You must be having wonderful impact on your patients, and you must be impacting other doctors around you with this approach.
Well, I don't know. I'd like to think so, but I didn't make it up. Definitely my father was that way. My wife is tremendously talented in that way and is often lauded as the best explainer of these concepts that anyone's heard. And there are lots of good models. You mentioned that the time constraints or the difficulties is often, I guess, blamed on the doctors. At the risk of sounding defensive, doctors don't want it to be that way either. It may be systemically foisted upon us that the corporatization or the time constraints or the systems make it so. And so you do the best you can in that kind of environment, but it will only be by collective patient desires, frankly, sometimes market forces, but also doctors and caregivers who are not satisfied with greater time pressures and greater robbing of their ability to communicate with patients at a real level. It's only going to be by those collective efforts that changes will occur in either, for example, Canadian or American systems.
Fair enough. We're going to take a quick break. I know that you have a real passion for men's health. So maybe when we come back after break, we'll have a conversation about that and why that's of big interest to you. So everybody just stay tuned. We'll be back in just a few minutes.
You are listening to The Health Hub here on Radio Maria Canada, a Catholic voice wherever you are. To contact us and be a part of the show, email thh@radiomaria.ca. We now continue with the program. Here once again is your host, Kathy Biasi.
Welcome back to the Health Hub, everybody. Dr. Hayes, as per your bio, you have more of a particular affinity to men's health. You specialize in that area. Why did you go down this path?
Well, not everybody who's an orthopedist has had broken bones. Dermatologists don't all have skin conditions, but I'm a man and I'm aging and I have a family and I have an extremely physically and emotionally challenging career, I guess. You have to have durability if you're going to practice in emergency medicine for a long period of time. You have to have immense durability to properly, in my view, engage the world as long as you'd like to do so. So it's an immediate need for me to study it and it seemed natural. But I think at least stereotypically men face some challenges to their own health. They may have reluctance to seek care, to talk about their problems, to admit vulnerability. They may have difficulty, as certainly women do, in finding time for access to healthcare. The popular media for men's health and its consumption by men is arguably not as well developed as it is for women. And men pride themselves to some degree on not going to the doctor. It's not only exacerbated by access problems, but by some cultural phenomenon of I don't go to the doctor. I don't need to. It's sometimes packaged into veneers of toughness or a cultural ethos. So I need it, and other people, my peers, need it, and that has fostered enthusiasm in me for trying to help men achieve a better version of themselves through access, willingness, and communication.
Do you think that with your ethos, and as medicine is progressing, we kind of touched upon it earlier, integrative aspects of health are becoming more commonplace. They're becoming more mainstream. So do you feel there's more of an openness as you're speaking to men, even women, with people going down a different health path because they're understanding now that it's not just the doctor says this, I have to do that, which can be combative in its nature. By having this ability to educate people on what they can do to prevent health issues, do you feel that there's more of an openness in this space for men?
I do, definitely. It's too long of a discussion, but people have asked me what I see changing about medicine. One subset of that answer is that I see the concept of diagnosis or gathering information to make a diagnosis as moving from the houses of medicine and institutionalized settings onto the patient and into their environment. We have wearables, we have monitors, we have all kinds of things, and we tolerate a much greater degree of monitoring in our worlds than we did 5 and definitely 15 years ago. The cars in my garage, I restore old cars. Well, the old cars don't tell me if your tire pressure's low. You have to get down on your knees with a gauge and check that, take the time, or you wait till there's a significant problem and the tire's flat and then you know there's an issue. You better deal with that tire. You can't go 10 miles down the road now in one of the modern cars in the garage without saying, hey, your left rear is 28 PSI. You better deal with it. The same is happening with our health. Men wear watches that tell them what's going on. They may have greater access to sleep monitors or health data. They may have more refined and less invasive ways to check on their own health, and men or women, the greater awareness, just witness what you and I do right now on this podcast, the greater awareness of simple things in pop culture are emblematic of the fact that people care more about monitoring their own status on their own. A good friend of mine is a real pioneer in integrative medicine, Dr. Russ Greenfield. He pointed out something to me the other day when we were having lunch. He said, 15, 20 years ago, there wasn't even yoga at our YMCA. Nobody did that much yoga, let alone yoga pants. Yoga pants are everywhere. Why are yoga pants everywhere? Because yoga is so much more accepted and widespread, and people understand how much benefit it may have. Who heard of turmeric or omega-3s, or just a short time ago, 15, 20 years ago, those were not part of the everyday conversation. Now, if I'm sitting with friends, and if it turns to this, there are many more cases of awareness, supplement, macros in your diet. Fitness and wellness is expansive. Now, that can be to our societal peril. And in this case, for men too, we're subject to dubious information sources and over-reliance on social media as a news source. And that can lead us down bad paths. But there's a greater awareness in men, and there's a greater awareness in women too. And by the way, those women educate the men.
Well, fair. We always get the swings, right? You're going to have the extremes, and then somehow we manage to land in the middle. I don't want to spend too much more time on it because I want to get into some things like fitness, where you've said that this is making such a huge impact. But doctors are going to have to change then the conversation. It's going to be more of a conversation. Do you see it coming down in the future? As there are going to be silly questions when people read their technology and come across with different things that are not relevant. But there is also going to be very relevant conversations that a patient can be able to have. Do we need to expand or change the way doctors are educated with their approach to a patient?
At times. I'm not privy to the curriculum in every medical school, but when I went to medical school, we did take nutrition, and that was ages ago, late 80s, early 90s at the University of Illinois. But the way we understand nutrition and its overall impact as a determinant of these other diseases that we spent countless hours on, I think is changing. I think the earlier we can intervene, and that goes way before medical education, the way we intervene with our children and young people to say, you can determine your future through the following ways. I think those are the ways that we're going to change in a sweeping way views on health from one's own risk factors. Here's a thought experiment that I do with young people when I address teenagers in groups or health talks I've given. Hey, everyone, check this out. What if I told you you could have any car you want? Any car you want. Here we go. You can have the most amazing truck or sports car or luxury car, some really cool. Isn't that cool? We'll give it to you. You can have that car. But there's one catch. That's the only car you're ever going to have. So now what car do you want? And how are you going to take care of that car? What are you going to do differently with that car, knowing that that's the only car you're ever going to get? Well, that's the way it is with your body and your mind. You can do almost anything you want on the front end, with obvious exceptions. Some people have genetic illnesses, all kinds of things that at this point anyway aren't necessarily alterable. But most of us really are subject to the choices that we make from the get-go. And if people are aware that those choices really will have the greatest deterministic effect, then they may make different choices over the long haul.
Mm-hmm. One of the, there's so many areas of health that are, not coming to the forefront, but being recognized. You talked about nutrition, and definitely that, it's always been there, but now we're seeing different approaches. That's fine. But to me, one of the biggest areas, and, as a person who went through a cancer diagnosis 12 years ago, I think it was, I was told at the time, because I've always exercised a lot. I've always, been in gyms, sports, whatever. I was told to settle down. I was told to stay quiet. Don't move around too much. Exercise is inflammatory. This was only 12 years ago. And that intuitively did not work for me. I felt that, being physical, being active kept me sane for a lot of it. But it also was, to me, it was a great gauge of, I was going through treatment for breast cancer, but it was my ability to keep my fitness level at a high level was a gauge for me, and I felt it extremely comforting. Off air, you mentioned this concept of functional fitness. Can you talk about that, and can you talk about the impact of fitness on health and where you have, if you have seen this come through in the ED?
Well, first of all, I applaud you as someone who faced a tremendous challenge like that for listening to yourself. And I think for a lot of people, staying more active, not necessarily accepting limitations on their physical activity and their fitness as they age, is a critical part of their longevity and psychological health and everything else. Mm-hmm. But only if they listen to themselves. So, and if they listen to emerging science, Dr. Peter Attia likes to say that exercise is the most potent longevity drug we have. Well, there may be others for different people, and one size does not necessarily fit all. People who have no cultivation of their social connections, who are desperately lonely, but are awesomely fit, are not necessarily better off. It has to be a balanced approach. But so fitness in general, the people that I see downstream in the emergency department, considering that prior discussion, if you break your hip, then is it a preventable condition if you had better balance or better fitness or had better awareness of your home situation and you could fit into that? You might have. Yeah, sometimes it's almost an insurmountable thing that might have befallen you. But most of the time, those types of things are alterable. Your posture, your low back pain, your a joint degeneration, those things are alterable with fitness early on. But fitness is not the 20 minutes of exercise that people might get in an otherwise busy day. Fitness to me is the overall movement during all your waking hours and the active attainment of recovery of that physical form during the sleeping hours. Functional fitness to me, I think of as a symphony, if you will, and there are 4 movements to this symphony. It's fine if you just hear one of the movements, it's good, and you can't necessarily hear the entirety of the symphony played every day, but I'll take 3 out of 4 every day. Those movements to me are to move more, to not move when you're not supposed to move harder, and to move more fully. Now, what do those mean? Well, quickly, move more is exactly that. It's not just move more during the 20 minutes. It's taking the stairs, getting the steps, going up and down, de-automating some of your physical life, the chopping wood and chopping onions, as I like to say. Moving more is a universally found thing in people that attain long ages. That's a obvious blue zone finding. Don't move, however, is often overlooked. And that what that really is stability. People that ignore their balance and only move, even if they work out all the time under controlled conditions, the narrow track of a fitness machine, for example, versus the balance and dynamics of the regular world, your balance decays. And that is one of the greatest challenges to your stability and the ultimate finality of going to ground when you're old. So how do you do that? Well, you don't necessarily have to go to Pilates or yoga or do ballet, but you can stand on one foot at any given time. And there are even studies that sort of reverse engineer that. How long, if you could stand on one foot for a certain amount of time, what's your mortality? Can you get up off the floor without using your arms or just with one touch point or one finger? That's don't move. Third is move harder. This speaks to your point that people believe they can't do resistance training. They can't do exhaustive anaerobic cardiac activity at different times. Do you want to injure yourself? No. Do you want to run right out there and do things like you were 18 again without training up to it? No, but you could get there, and you should get there to the best of your ability consistently if you want to maintain muscle mass, muscle strength, reverse the inevitabilities of sarcopenia. And if you want to maintain your VO2 max, meaning your wind. Do you get winded when you're 90 trying to walk upstairs? Well, you'll be way further ahead if it doesn't wind you to walk up multiple flights of stairs when you're 40. And then lastly is move fully. And that has to do with your flexibility. Can you bend, move, stretch the ways you could 5 years ago, 10 years ago? Do you just accept that that's the stiffness of age? That's not borne out in science. There are people that are maintaining that flexibility. I may not be one of them. I'm not a saint in any of these areas, but using those 4 movements to a symphony and trying to get at least 3 out of 4 every day, I think is the best approach to fitness I've found for me.
I think the way you have explained it too is it aligns with something that I've been thinking about a lot. You know, when longevity became sort of the big mental or medical space and integrative space, you know, longevity science, people started, you know, on the internet posting things about fight longevity, fight aging, fight. And, you know, there's only one inevitable outcome, as you mentioned. And I think the word fighting and I think battling needs to be replaced with the acceptance that we are aging, listening to our body, understanding that at every age we need movement. I think a kinder, gentler approach is starting to come into foray, maybe using the functional fitness as a sort of the new way of talking about educating yourself with the 4 areas that you talked about is turning out to be one of the better approaches to physical activity in the last few years. I've seen many recent posts, more to do with women's space actually, about not going so hard, but going in sort of in an approach that you are talking about. And I think it's a great way because that makes it more accessible to people. You know, when you're talking about everyday walking and moving and, you know, standing up and cutting this and that, those are everyday things that I think need to be brought into the foray of fitness. And I applaud you for doing so, because I think that's one of the ways that people can start achieving better fitness. We unfortunately are really pushing up against the clock because I have so many other topics I'd like to discuss with you. But, you know, if people wanted to get in touch with you, learn about what lasting impact is, where would they reach out to you?
Well, thank you so much. I feel like I'd love to continue this conversation as well. The first place they would go is lastingimpactwellness.com to our website. You can join our community, get our newsletter, and begin a conversation whether or not you would choose to work with us going forward. We would also welcome your listeners, I think, in a complimentary fashion to our podcast, Lasting Impact Wellness, available on all major platforms. But I think most of all is we just feel strongly about cultivating this kind of good information available to everyone. The egalitarian nature of health and well-being today is a wonderful thing to see and hear, and I applaud you for your efforts as well.
Well, thank you. It was really a real pleasure to have you on the show. I really admire what you're doing, in the stressful situations that you're in. So thank you so much for taking the time to be with us today.
Thank you, Kathy. Honored again to be here.
Everybody, we will talk to you next week on The Health Hub.
You have been listening to The Health Hub, hosted by Kathy Biasi, here on Radio Maria Canada.